Welcome. My name is Edward Ferrier. I'm a facial plastic surgeon. I've been practicing in Tampa for over 25 years. I would like to take this opportunity to discuss rejuvenation of the upper third of the face with you. What are we talking about? The eyes, the brow, and the forehead. This area is usually considered as one unit when discussing facial rejuvenation because the separate segments, the forehead, the brow, the upper eyelid, and the lower eyelid, generally impact how each other look and appear. So, as though discussing this with a patient in my office, I'm going to go through the same process with you. Most people come in and ask, well, I need to do something with my upper eyelids. I have all this heavy skin and I can't hardly see. Typically, that's a combination of two things. One is the brow over time begins to droop and gets a little heavy, like mine is. Second is the redundant upper eyelid skin. They are two very distinct issues, in some patients related to one another, in most completely isolated. To do something with the upper eyelid skin without addressing a ptotic brow is almost fruitless, because you can take off that extra skin, but the eye will not look any different because there'll be all this infrabrow skin which will still sit in the same position and the brow will be heavy. So in most cases, with rejuvenating the upper eyelid, you need to do both the brow and an upper lid blepharoplasty. Now, the brow is done to position the brow in a natural position with a natural contour and shape. It is not intended to make it dramatic or drastic or surprised or startled or what some people refer to as the deer in the headlight look. That is not the goal. The goal is to put the brow in the proper position. In most women, that position means the bottom of the hair of the brow at the superior margin of the orbital rim, or the bone, that ridge of bone above the eyelid. In a male, it typically means that the hair is placed right on top of that bony ridge, so more subtle. In addition, the ideal high point for the brow, which used to be described as even with the lateral limbus, which is the lateral portion of the iris, or the colored part of the eye, was where the arch was supposed to be. That's unnatural. It looks surprised. It's so 1960s. The real ideal position is that the high point of the brow should be even with the lateral canthus of the eye. So right out here, not over here. Now, how do you execute a brow lift? Well, most of it's the same, with the exception of how you make the incision. How you make an incision is dependent on the hairline and the contour of the hairline. I would say, in my practice, brow lifts are most often done with a trichophytic incision, what I refer to as a hybrid brow lift, because it combines the features of an endoscopic brow lift, which make it less likely to result in numbness on top of your head, less likely to result in hair loss, but it also avoids moving the hairline. So in a patient with a high hairline, kind of like mine, that you don't want to move up any higher, the incision is made. It starts there, goes back along the hair. What this accomplishes is we can lift the brow without moving the hairline, and the skin we're excising when we do the brow lift is non-hair-bearing forehead skin. So that's what's called a trichophytic endoscopic, or in my vernacular, a hybrid brow lift. Okay? The other option is an endoscopic brow lift. So in a person with a low hairline, meaning a short forehead, if the forehead is elevated or the hairline and the forehead is raised a little bit, it's not going to create an abnormally high appearing hairline. You can then do it endoscopically, which is small incisions. The nuances of the procedure after that are virtually the same. The scalp is released from the skull and repositioned. In that process, some of the muscles which cause the brow to descend, such as the corrugator supercilii and the procerus, which pull the central brow down and make you frown or look angry, and the orbicularis muscle are released. And thereby those forces that bring the brow inferiorly as we age are relaxed so that the brow is not pulled back down. It also helps reduce crow's feet and reduce the 11 or the lines between the eyes. The brow is then suspended and held in place. As the brow lift heals, the swelling will go away. There will be bruising of the upper eyelid. That bruising may persist for several weeks, but it will also resolve. The numbness of the forehead or the scalp caused by a brow lift will usually begin to resolve at 6 weeks and will sometimes take up to 6 months to completely resolve, but it will resolve and get better. Doing a brow lift, if there is extra upper eyelid skin, doesn't eliminate the need to doing that upper eyelid skin. Upper eyelid surgery is straightforward, but maybe not as straightforward as it would seem. Typically, there's just taking off the skin. That eliminates that extra skin, can sometimes help you see a little bit better, certainly makes the eyes feel less tired. And that suffices in probably 90% of patients that need something done with their upper eyelid. There are, however, patients that either have ethnic or congenital differences in the eyelid, which means there's a lack of an upper eyelid crease when the eye is open. In those patients, typically a thin strip of muscle is resected and the skin is then tacked down to where that muscle was resected to create a crease when the eye is open. Some people also have central puffiness of the upper eyelid, which is herniating fat in the eyelid, which can also be removed at the time of an upper lid blepharoplasty. The nicest thing about upper eyelid surgery is the skin is very thin, which means the incision heals exceptionally well, and the incision retracts whenever the eye is open. So if the eyes are open, the incision cannot be seen. The only one to truly ever see that incision is you, if you're putting on makeup or eyeshadow. Thank you very much for listening. I hope this was helpful. Please feel free to call the office and ask questions or schedule an appointment. The phone number is 813-875-3223, or you can visit our website at drferrier.com. Again, thank you for listening. Be safe and always feel comfortable asking questions. Thank you.